As an orthopedic surgeon, I regularly write antibiotics for patients. I do complicated procedures, which often create scenarios where bacteria that are not good for us can get into places where they can cause infections, cause complications, and significantly derail the outcome that we're looking for. In these scenarios, I will write an antibiotic before I even start a procedure, so they've got antibiotics floating in their bloodstream, which can fend off or fight off any bacteria that might get into the system while I'm doing a surgery. The intent of this is to prevent and protect the area that I'm working on. A lot of times as we're doing things to help people, there are side effects of what we're doing. And those antibiotics can ultimately result in additional effects that can cause problems. For example, when you take a particularly strong antibiotic, that antibiotic doesn't just affect the area that I'm working on, it can also affect the gut. And in the gut is the opportunity for the body to process food, process proteins, process fats, process sugars, and the processing and production of those ultimately result in how well the system is going to function. Without those, you end up with some serious side effects. Those side effects in general can be things like diarrhea, prolonged infection, feeling ill or poor, fatigue. Those type of symptoms are results sometimes of what those antibiotics ultimately have done, which is hurt the good or healthy bacteria that naturally live inside our guts. In general, when I write medications for patients, my wife taught me a long time ago that it's really important to be considerate of the side effects of the medications you give. When my wife had her first child, her OB doctor provided her some pain medicine after she had a C-section, and that pain medicine, very well known, causes constipation. And she unfortunately dealt with some very severe constipation after having a C-section. And we had this long conversation. I was a physician in training. We had this long conversation about you be a good physician and make sure that you're thinking about all of the things that happen to patients when you give them medications. And so I consistently and regularly now make sure I provide a nausea medication as well as a stool softener when I provide narcotic medication for patients. In like fashion, I've been having a conversation with my patients about what happens when I give them an antibiotic and what are some of the side effects that you can have when you do that and what are some of the things that you can do. So in addition to taking a laxative and a nausea medication, I started to add a probiotic. What is a probiotic and why should you have it? Well, when you take something like an antibiotic, and I want you to take a minute and think about how many times are you inundated with things like antibiotics. There are antibiotics in different foods. There are things that will kill bacteria in different cleaners. Lots of opportunities during your day do you run into things that could affect or damage your microbiome, meaning the good things that help you process the things you need in order to survive and survive well in our world. So if you damage that series of things, you end up with those side effects: diarrhea issues, urinary tract infections, yeast infections, etc. And as a surgeon, I get the opportunity to see all of those side effects when I give patients antibiotics. And I do it regularly because I perform a pretty regular amount of surgery every week. So when those patients have come to me and they say, what could I have done to prevent this? As I've done my own research and looked into it, what I'm affecting is the natural course of bacteria in our body. We have good bacteria, we have bad bacteria. The bad bacteria, aka a bacteria that's in a place that it shouldn't be, or too much of it, is when we start to have problems. So for example, a lot of people have heard of a bacteria called Clostridium difficile. Difficile being it's difficult to get rid of. It's a special type of bacteria that resides in a very small amount inside the gut. And when you give an antibiotic that doesn't affect it, but affects the other bacteria inside your gut, you end up with an overgrowth of this one bacteria and a severe case of diarrhea, sometimes life-threatening, severe. And so why don't we as physicians provide patients with the opportunity to support the good bacteria while we're trying to fend off something that's bad? When you have a sinus infection, when you have an ear infection, when you have a tooth abscess, when you have an infection in some other place of your skin, when you have, you name it, urinary tract infection, et cetera, the list goes on, we provide these antibiotics. We should be simultaneously providing a probiotic or bacteria that can continue to be in the system that we're not going to knock off or kill off with this antibiotic. And as we do so, we get the opportunity to see fewer side effects. We get the opportunity to prevent some of the difficult adverse reactions that we have to antibiotics. There are lots of important probiotics. When we look at the effects of probiotics, this is just one narrow sliver on how we understand why they're so important. We know that when we don't have those bacteria inside our gut or inside the vagina or inside the urinary tract or inside just on the skin in the normal places they need to be, you end up with infections, yeast infections, urinary tract infections, diarrhea, etc. So making sure that we have the right bacteria in there is actually essential to successful living. We have such a preponderance of things that will kill off bacteria in our lives. We live in a very sterile world. We like clean. We like the lack of anything that we find kind of offensive. But the reality is, your body needs bacteria to be successful. Your body needs bacteria to feel good. Your body needs bacteria in order to process the foods you eat every single day. If we are not consuming probiotics, parabiotics, live bacteria, dead bacteria on a regular basis, we are going to have complications. Now, don't get me wrong, there's going to be people who say, oh, well, bacteria are bad for you and that's what caused my gut issues. Yes, when you have too much of a certain thing, you can ultimately end up with having issues. But that's why picking the right groups of bacteria, we call those strains, the right strains of bacteria inside your probiotic is essential. So we need things that promote gut health. We need things that promote urinary tract health. We need things that promote prevention of yeast and other things taking over so that you don't end up with yeast infections and other issues. If you were to open a refrigerator and it doesn't smell very good, you know what's in there. A whole lot of bacteria that you don't want, okay? What you don't realize is that when you open up something like Parmesan cheese or something, it's a very specific subset of bacteria that helped you make that. Pleasant odors are also the result of bacteria. And so as we go through our lives, if we're getting too much of one thing, too much sugar or too much of this or too much of that, we're feeding a group of bacteria and we're gonna get too much of them. And sometimes the things that they result with are not things that we want. And so if you've got odor issues, if you've got urinary tract issues, if you've got gut issues, you probably lack the friendly bacteria that you need. I would encourage you to take the opportunity to read about bacteria, read about the gut, read about urinary tract infections. You're going to see results in loading your system with the good things. You're going to see results in recognizing that you're killing off bacteria with a lot of the things that you eat, with a lot of the medications that you take. So be thoughtful. Add to what you're doing to balance out your gut, to balance out your health, so that you see the benefits that are available to you. I recommend you try Nook Probiotics. It'll make the difference.